Περιμένω. Κύριε Πρόεδρε.
President of the government, dear guests, we'd like to welcome you. My name is Andreas. I'm the head of communication of the Stavros Niarchos Foundation, and we're here to talk about health. Health, which is the most important thing that we have. And it's something that we forget, and we appreciate it only when we lose it or no longer have it. And health is something that must be ensured for all. So access to health must be ensured for all, and this access should be the same whether somebody's in a remote area or in a large city. So health must be the same for all. So for us, health is not only major hospitals or the infrastructure, the equipment, or anything else. Health means mainly what each and every patient feels and should feel. And what is that? Respect, dignity, and hope. That is why we're here. And that is what we're trying as a foundation to contribute, so that the state can be in a position to offer the health services that are going to make everybody's life better. Health services should be something that's self-evident for each and every person, be they young, be they old. From major cities to the most remote islands. Health is not only hospitals, equipment, education, research, treatment, but it's more about dignity, respect, hope for those who need it. That's what we believe. And that's what we're trying to achieve. In order to improve health services for a better life. Learn more about it on SNF.org here. Mr. Andreas Dracopoulos, who's the president of the Stavros Niarchos Foundation, but also Mr. Yannis, who's responsible for the foundation's projects, is going to talk about the breadth of what we're doing here today, the Health Initiative. And at the end of the event, we're going to have the 17th meeting of the Special Advisory Committee for the Health Initiative, which is going to take place in the tower of the National Library, which is just next door. Those of you who want can watch it live in this large screen. And also I'd like to say that in the adjacent space, upon the end of the Special Advisory Committee, it would be very nice for you to see certain of the drawings and the models of Renzo Piano with respect to what is going to happening in Komotini, Thessaloniki and Sparta. So for those of you who don't speak English, I hope that you are able to have headsets for the translation.
I suppose you already your headphones for the translation. If you don't have them, please do. There are some in the lobby. Οπότε ο λόγος σε εσάς.
We'd like to hand over to you. Well, President of the government, ministers, dear guests, your Beatitude, thank you all for being here today. I'd like to also thank those who were present in yesterday's event, and we talked about what the Foundation is doing in terms of art and culture, and some of the things that I'm going to say today, things that I've said yesterday, and please forgive me if you were here yesterday. I'd like to thank my uncle, Stavros Niarchos, who is the founder of this foundation, and he died in 1996. And without him, we would not have been here today. So the foundation started acting the day after, and it's been almost 25 years, and in 2 months' time we're kicking off the 25th year. I'd also like to thank all my associates in the foundation, because without them we wouldn't be here. And I would like to share a few things. First and foremost, the figures don't say a lot in and of themselves, but they're still figures. So I'd like to say that we've been here from 1996, about 25 years. The 25th year is this one. We have given $3 billion in grants all over the world, and this is important because we've gone to 124 countries. Greece, of course, for obvious reasons, has in fact received 2 billion approximately out of the three. So you understand that the main space of our activities was, is, and remains for as long as you want as Greece. Now, let's talk about our philosophy a bit, because it's very important, I believe, to share also how we think. So I wanted to say that we always supplement, we don't replace. So in the four sectors that we are present, education, social welfare, health, and culture, we try to also supplement, and we work together with our grantees, and we don't want to replace them. We wouldn't want to do so. We cannot do so, in fact. Even if we would have wanted to do so, we should not. And that's what we think in the initial phase, always. At the same time, we think that in the difficult times that we're experiencing, the meaning of the welfare state has, in fact, become weaker, because in and of itself it cannot do things that it should. And we need, in fact, a society of welfare. So that means all those people who want should give a helping hand, and that's for the common good. And that is, I think, a very important factor, common good. And we talk about sustainability, and we talk about environmental sustainability, and the sustainability of humanity. But we forget to talk about the sustainability of the human touch. We are losing this humanity. So without this, we won't either save mankind or the environment. So in a welfare society in which we must proceed, which is a matter of necessity for us all and not a matter of option. So in such a society, there must be cooperations, and we must do this correctly, with respect, with hard work, transparency, and we must all do it. And everybody must join in wherever they come from. And always we must pursue our common good. And we're talking about the cooperation of people, because behind each institution, each foundation, there's a person, there's the individual. So we have to look at to find the correct individuals that we should work with, but we must also do this in pursuing the common good. And we also want these to have multiplying benefits wherever possible, and to have real results, because we hear lip service, but we see few acts. So we want to see truly the impact in reality on the ground. In the event about art and culture, we said yesterday, we saw that things were took a bit of longer, and this might be the case today also. I know this, and this is very respectfully, if anybody here is bored, they can leave, but we will stay, because there are a lot of things we want to share with you. And what we weren't able to yesterday, because we were rather late in finishing, is to open the floor for questions. But we are here to answer the best way possible to the questions you might have. So, we're talking about the initiative of Stavros Niarchos Foundation about health. And we believe that health is a necessary good. And since 1996, upon our establishment, we have in fact worked in this sector with 125 million in grants, in various grants. ECAV, the ambulance services, which about 3 years ago procured 143 ambulances and their full maintenance for a period of 8 years. And we're also talking about the procurement and installment of 12 linear accelerators in public hospitals across Greece, 2 of which are military. And Panos Vazeos is going to talk about these also. And we're talking about the amazing cooperation that we had, the amazing project that Regeneration and Progress has done. This NGO does a lot of work, but soon we'll have Takis Koulouvaris who's going to talk about the mobile medical unit. And we're very proud of these because this is something that brings about a lot of good. And we have actually, in fact, renovated the ICUs in Greece, 5 pediatric intensive care units in Thessaloniki and Patras, in the University General Hospital of Heraklion, and the Children's Hospital, the 2 children's hospitals in Athens. And we're talking about the construction and outfitting of hostels for the relatives. Let's not forget about the relatives of patients in Alexandroupoli, Ioanna, Patras and Crete. And there has been also another set of renovations and procurement of equipment. Now, before actually getting into the details, I'd like to have Panos Vazeos talk about the linear accelerators, and then Takis is going to talk to us about the medical mobile units, which is very important.
Good afternoon. Replacement of linear accelerators, 12 in 9 public hospitals in Greece. This is an initiative of the SNF, which is based on the same philosophy mentioned by Panagiotis and Mr. Dracopoulos: free access to reliable healthcare services, modern healthcare services for all. During the implementation of the grant, we worked with the competent services and authorities, both in Greece and abroad, the Greek Radiotherapy Unit, the Union of Radiophysicists, Johns Hopkins University, the equivalent department there, together with the MD Anderson University of Texas. So we visited all the countries in Greece which had a radiotherapy department, and there we saw that 67% of all equipment was at the end of life almost, meaning this was a situation which meant that they couldn't even be maintained. So the 12 linear accelerator grant helped in the quality upgrade of services, healthcare services that were offered. It gave tools to the doctors and their teams to apply state-of-the-art techniques that are applied in Europe and in the US. Thank you very much, Panos. And Takis Koulouvaris now has the floor. Good afternoon. He is the founder of Regeneration and Progress, the NGO, and we've been working for how many years? Since 2014. The mission, 67 missions. This is a groundbreaking primary healthcare project. It began for the 24 remote islands, 67 missions. Now we have started the 68th. Unfortunately, all our doctors and nurses are stuck in Samos and they're waiting to go to Fourni. The ferry boat will arrive at 11. We have a continuous rotation. The missions till 2019 were once a month, and now we also cover remote mountainous areas, meaning we have 3 every month. So we are in Furnos in January. Then we change the team. They go to Rakis, Ikarias, Kassos, Ikaria, Anafi, Folegandros. So the MMUs never stop. And we have, this is under the aegis of the Ministry of Health, the University of Athens. So the previous administration of the Ministry of Health have worked in an exemplary fashion, and so has the current one. We know that our only enemy is a disease, and we want to help with the treatment of all citizens. Maybe let us note that all the doctors participating are public doctors. They're not from the private sector. Let me make it clear. This is something organized by the NGO, but we have participation of doctors from the Greek public sector as well as university professors and doctors. And healthcare doesn't stop there. If there's need for further help, we bring them to Attikon Hospital, to Laiko. We have treated over 380 patients in the last 3 years. This is a great example. It shows what a partnership can do, and not only between the public and private sector, but also through charity. So we're all united. The only thing we have in mind is the public good, and our only enemy is disease and nothing else, our only adversary. Now, let's talk more about the health initiative. As you know, the building we're in belongs to the SNFCC. This is our biggest grant to date. It cost 700 million euro. And we gave it to society. We're not saying to the state, because we believe that the state serves society. And we've said from the start, from the outset, that this is something we have given to society, and it is operating very well, even though some people said that you're giving it to the state and to the government, but it's been working in a fantastic manner. We've said that, and a lot of people talk about PPPs, public-private partnerships, working in tandem, and nobody would have believed this would have been so great. But I think this building, the SNFCC, is a very good example of excellent collaboration between the public and private sector, and of course transparency, hard work is required as well. And this project was given in February of 2017 to society. So in the summer of 2017, we had a discussion with the Ministry of Health, with the then administration, and we aired an idea. And let me thank Professor of Evangelismos Hospital, Mr. Roussos. Where is Mr. Roussos? He's over there. Because it all started thanks to Mr. Roussos. This was his idea. We were talking about doing something in Evangelismos. Evangelismos Hospital, as you all know, is the flagship, if you like, of public health. So we looked at Evangelismos, and we looked at the needs that this hospital has. So that's how it all started. That's how effort started. That's how we tried to contribute to the effort undertaken by the state to offer the best possible services, healthcare services, to the public. I don't want to hog the microphone, but it's important that in August of 2017, we met with the ministers of health, and I think they're here, Mr. Xanthos and Mr. Polakis, and we had a very constructive and fruitful discussion. And this is very important, because no matter where we come from, politically speaking, financially speaking, when there is good collaboration, and when we understand that what is of great importance is the public good, we can work wonders. And the Stavros Niarchos Foundation, yes, collaborated with Syriza when it was in government, and the result was excellent. And this collaboration continues in an exemplary fashion today. And we're really happy that the public, in the broad sense of the word, works with us, it collaborates with us, and there is no agenda. All we have in mind is to serve the common good. The public good, and I'm saying this and I'm proud as a Greek citizen, not just as the president of the SNF. So it was an open discussion. We started talking about Evangelismos. We heard the ideas of the ministers regarding the needs of Evangelismos. I don't know if you know, that there is no pediatric hospital in Greece outside Athens. I'm ashamed to say this. I grew up in Athens. I live in America, but I didn't know that there was no pediatric hospital outside Athens. So for us, it was very important to see where we could build another pediatric hospital, for example, in Thessaloniki. Now, Komotini. Komotini Hospital is the oldest general hospital in Greece, and it's of national importance for other reasons as well. So we started building a program. This is why we called it the Health Initiative. And soon we will talk about what it includes. But let me just say that this is a health initiative that is still evolving. It was built together with the public sector. So in March of 2018, we had the signing of an MOU with the state. It's very important to mention that the first budget we then discussed was 200 million euro. 200 million, and I think that in the signing it says 200 to 250 million in the MOU. Now, as we stand, we have reached 420 million. This doesn't mean that the budget has skyrocketed. It means that we have included more programs and more projects, and we'll talk about it later. And then in September of 2018, we had a ratification by law, and this was in the Greek Parliament. So we had the grant contract that was ratified, and now we have a budget of 420 million. But it's not just the money. What's important is what projects are included thereunder, because I believe that this is a joint effort, a holistic effort in order for us to help the health sector in Greece. So what's included in this initiative is one, the outfitting and construction of 3 new hospitals. One is the SNF General Hospital of Komotini. The other is in Filiro and Thessaloniki, the SNF University Pediatric Hospital. And the last one is the SNF General Hospital of Sparta. We also have the enhancement of the nursing sector, because we believe that in order for an initiative to be successful, it's not just partnership. We're not only interested in infrastructure, in buildings. I think that the juice lies in people, and we have to help through training. We have to help people working in the health care sector. So we try to support the nursing sector, and we're talking about procurement of equipment and educational programs, both in Evangelismos, but also in ECPA, the National Capodistrian University. And we also wanted to have procurement of specialized equipment for Evangelismos General Hospital. That's where we started off, but for various reasons, I think it's worthy of discussion. Nothing is perfect, says the speaker. But we then went back to Evangelismos, and we will have procurement of equipment, and we have a new piece of news. This is something that will be announced for the first time today. We're talking about the new ECAV air services. So it's not just the 143 ambulances. We're talking about 2 new airplanes and 2 new helicopters as well. And we're talking about procurement and installation of PET scanners. So we're talking about positron emission tomographers. Don't ask me what positrons are. And we also have the financing of educational programs. One has to do with in-hospital infections and treatment of trauma. These are 2 things that are very important, not just in Greece, but in the whole world globally, that is, when it comes to hospital settings. So what's important in this effort undertaken, and here again we are talking about excellent collaboration amongst all stakeholders with transparency, lots of hard work, showing respect to the timeline, and all this is for the common good. And I think that we have learnt as a foundation the good results that can be the result of such collaboration. And this is the case of the SNFCC as well. The SNFCC took 8 years to build. 7 different governments came and went. And this didn't appear anywhere. There was seamless, if you like, collaboration. The timelines were respected. The teams were always focused. And I can say that everything went well, and I think the same will happen now. And this is very important. We've also worked together with a lot of consultants. We have 21 consultancy firms, 13 of which are Greek, and they're participating in the design of the 3 hospitals. We also have hospitals outside Athens, like John Hopkins, that has come and offered consultancy services here in Greece to us. And in relation to the nursing sector that we talked about, we have people from EGPA and from Evangelismos visiting John Hopkins in order to see what's happening at the John Hopkins Hospital and to see what we could do in Greece today in order to improve the healthcare sector and the services offered. I think Yannis can now talk a little bit about the role of the advisory committee, the special advisory committee. Today we will have the meeting of the 17th meeting of the special advisory committee, which will actually convene live after the end of this presentation. And I'm going to give the floor to Yannis, who will talk to us more about this committee.
Thank you, Andreas. We cannot do what Andreas described alone. So we have, in fact, a lot of associates and organizations, the hospitals, EGAB, all the bodies that you heard about before, and at the same time, the Greek state, which together with us is actually sitting by our side, and we are able to coordinate this very difficult and complex project. So we have the Special Advisory Committee, as we call it, which is made up from representatives from the Prime Minister's office, the Ministry of Health, Education, Finance, Environment, Infrastructure and Transport, EGAV, the Nursing Department of the Health Sciences of the National Accommodation University of Athens, and other stakeholders. Every month we met up and we talked about all issues at length. There are obligations that are ours and obligations that belong to the Greek state. We sit side by side and we do our work, and every month we come back and report to each other what we have done, and we help each other to resolve the problems that might exist. And at this point, I would like to actually give the floor to Marios Themistokleos, who is the coordinator of the Special Advisory Committee on behalf of the Greek state, to say a few words before we continue. Good evening to all. I think Mrs. Advikis has already described what we do. In summary, we try to make certain that there's no hindrance that would delay us in realizing the grant. But also we have to also give us the benefit of innovation, and this has to do with seeing things from a different perspective in terms of concept and implementation. So we're at a very good point. We have actually picked up a good pace, and I think we are a strong team that moves in tandem. And beyond the pleasure of being creative, and this is what's so nice about it, it's also very nice to see that we are obtaining our targets and achieving our targets, and we want to actually improve Greece and to enhance its course. And we know that this is not simply lip service. There is a team spirit, and we know that we're acting in concert for common good. And I'd like to thank everybody who are members. Let's talk about the 3 hospitals now. And then Yannis will say a few more things for each and every hospital. I think that there are 3 units that are going to play a very important role. And we have also Renzo Piano with us, the architect, whom I'm going to ask to tell us also some things from his side. But for the moment, before that, let's just say a few things in description. In Komotini, we're talking about a budget which is about 105 million euros, and the completion will be the first of the 3 that's going to be completed because it started out earlier. And June 2024 is the completion. So this might seem to be a bit far away, but it's 4 years from now. And it's one of the oldest hospitals of the country, and it started in 1937, and it is, in fact, it was built with a grant of 26 million drachmas of Thessaloniki. Jens, would you like to say a few more details so that people can understand more about the hospital? Now, the main features of the hospital, although afterwards we will have Renzo Piano talk to us and give us more details, but I'd like to say the main features of the hospital and the way that we've actually approached it. And when we say we have, I'm not referring to myself. I'm talking about, or the foundation, I'm talking about jointly the state and the foundation, 181 beds. And these are two and single bed rooms, and this is true for all. So we are going to increase the surface area by 50%. So it's 17,500 of the existing, 25,000 will be the end result. It's a green building such as this. It's also going to receive a certification, as this also does. It will be well equipped through the grant. It's going to be fully digitized as a work environment, and that means that it's going to be a paperless hospital, and it's also going to give the users the possibility to work on the basis of best practices. And we all understand that the building in and of itself will not, in fact, be able to do anything if we cannot have human resources capitalize on it. And that's where we have to work together with the Greek state. Now, how have we reached this point? In order to determine what we wanted in Komotini, we visited the site often, together with our advisors, in order to understand what this new hospital had to be. So it's next to Alexandroupoli and Kavala. So Alexandroupoli is 40 minutes away from the university hospital there. So you might say that somebody who lives in Vailophalia, in order to reach Evangelismos on a day with traffic, needs 30 minutes. But if you're in the provinces, the time you need to get somewhere is completely different. And it's always important to have a hospital in such an important area. But we went and saw what Alexandroupoli had to offer and what Kavala had to offer. We didn't want any overlapping services. We wanted to have the hospital offer what it needed to do without rivaling the others. So we're creating a hospital that has complementary services to the other two. I'd like Mr. Dracopoulos to say a few words with respect to this subject before we go to the next hospital. So good evening from me also. I'm from the team that worked together with the foundation on behalf of the so I'm sorry that I didn't say that he is a scientific advisor. So we worked in Komotini. We'd actually seen the program on the basis of the needs that the foundation had ascertained. I must say it's impressive that the hospital has clinics, as Mrs. Advaikis said, which are complementary. And for us, it is, in fact, a new cell. It is a young cell in the network of the hospitals in Thrace. And what I think that we'll be able to see is that it is a hospital that is very much centered on people. It has the patients, it has the relatives and visitors, the staff, all the staff, be they doctors, nurses, or administrative staff. It has suppliers, researchers. So that is a very lively cell. And what is very impressive here is that it actually takes into account all of them. Patients first and foremost, by giving them an amazing healing environment within nature. And it helps them very much in their nursing because they don't circulate a lot in the hospital. They're protected from in-hospital infections, the nosocomial infections as they're called, and that is prevalent during people's stay. And we have easy access for the relatives and visitors, so they can sit next to the patient, and there could be a small bed that can be made up next to them. And the staff does not have to circulate ineffectively throughout the hospital. We have a very effective circulation, and we see that all of this is in fact working very harmoniously, and this is with the backdrop of the building. I think Mr. Renzo Piano will be able to explain how this works. Thank you. So let us now go to the Pediatric Hospital of Thessaloniki, which is also of a budget of 150 million euros, and we hope will be ready and in October 2024. So it's going to be the first children's hospital in northern Greece, not only in northern Greece, but outside of Athens. Would you like to say a few words?
So as you can see, 200 hospital beds, then all the characteristics are the same. You'll see the same in Sparta. All three hospitals have the same principles, common principles. So I don't need to repeat everything over again, but let us talk about how we approach the creation of a brand new hotel, because we're not talking about a replacement here. It's not that a new building is coming to replace an old building. It's being created. A new cell is being created. And there we had to understand very well, together with the Ministry of Health and our consultants, what's happening in northern Greece, what the needs are in northern Greece. And we recorded all the needs. We took statistical data from all the patients who come to Athens and the clinics in Thessaloniki handling cases. We know that there's no pediatric hospital, but there are pediatric clinics that treat children. So everything was recorded. It was jotted down, and we came up with a plan. So according to this plan, in this new hospital, we will have all the surgeries. It's a tertiary hospital that will cover everything, and the building is designed in such a manner to cover all nursing services, even if they are not required right now. At the same time, given that the building is in Philiron, a little bit outside the city, in the city, we need to have some services that will cover primary health care, meaning young patients, if a child falls and injures itself, it doesn't have to go to the general pediatric hospital right away. So we have some clinics that remain within the city of Thessaloniki, and the rest is covered by the new pediatric hospital. Now, let me also say at this point, that it will be 3 months after Komotini. It will open up 3 months after Komotini, and we'll be able to ratify it by law in May of 2020 and to start the implementation phase. And now let's talk about the third hospital. But before doing so, let me say that the underlying philosophy of our collaboration is that since last year, every 6 months, a team of ours, together with the municipalities, both in Komotini and in Sparta, so we go there, and on that day we arrange meetings, presentations, and a dialogue with communities, with a local community, in order for everybody to know exactly what we're doing, what we are planning to build, and how this will impact their lives. Now, for the Sparta Hospital, which is the last one, it will be ready in February of 2025. The budget is 90 million euro, approximately. Sparti Laconia, this is where our founder came from, and it's the second oldest hospital in the country. It was actually built in 1939. And what is noteworthy is that Ioannis and Katerini Grigoriou were the donors. They were Laconian benefactors. And let it be noted that while the new hospital will be built, the old one will continue to operate. There will be no interruption. Do we have anything special to talk about here in this case of the Hospital of Sparta? We recorded the needs. We saw what the nearby hospitals have to offer, because we wanted to play a complementary role. We don't want overlapping. So I'm now going to ask Renzo Piano to give us a brief presentation and tell us his philosophy regarding these 3 hospitals. And then afterwards, before we continue, we can open it to the audience for questions. Let me say that Mr. Renzo Piano, and I said it yesterday as well, is a friend. He is a true Philhellene and a true man. and he's a wonderful architect as well. And whenever we call him and ask him for help, he is always ready to come to Greece and give a helping hand and help us also with the Archaeological Museum of Sparta. And with the exhibition here as well, area of Desmotes, the skeletons that were bound in shackles. Renzo, the floor is yours. Thank you very much.
Thank you. Thank you, Andreas. Practically the only problem I have is that I'm not Greek, but I'm learning. I'm learning.
Yes, you are.
Now, I will try to make short a long story, because it's a long story. And I'm talking on behalf of a group of people. We are working on this job. We are about 50 people, even more than 50 people. Nothing happening on this planet alone. You know, everything is a result of collaboration. So we have a fantastic group of people from doctor, medical specialists, and architects, engineers. So I will try to make short. Anyway, let's start from here. You can see where we are. We are working at the same time on 3 hospitals. The one in Komotini, northeast of Greece, you know where we are there, is a general hospital. The other one is in Thessaloniki, in the north of the country. This is a pediatric hospital. And the third one is in the south of Greece, in Sparta, and this is again a general hospital. Can we go to the next? This is the section of us. I will go fast, but anyway, this is a section of Komotini. Actually, the level of the ground now is the bottom one, you see there, and so we are lifting up everything because we have a risk of floods there. Here, the land is flat. And you can see in this sketch already that the building is made, the concept is that we have 3 layers. The ground floor, that is here is being elevated. Then we have a lower floor that I don't call underground because it's not underground, as you can see. Actually, we lift the ground to be able to see out because we don't want to make underground part of the hospital. And then we have the walls up there, flying above. Can we go to the next? And this is the same section of the Thessaloniki Hospital. Again, you can see you have a portion that is ground floor, and then we have something that is happening below that level. But in Thessaloniki, we don't have to lift anything. We have already the hill. So, and the walls up there. This is the walls on 2 levels. In Komotini, it is 1 level. Next one, please. And this is the same section on Sparta. So you can see the same concept. We have part of the hospital that is on the ground, and part is below the ground, but it's not, as you can see, you see out. Next one. This is the section of Thessaloniki, just to make clear. On the ground floor, we put all the functions that are more public. They are connecting to the city, to the town. This is where we have the reception, this is where outpatients, education, because all those 3 hospitals have a connection with education. So this is almost like the surface of contact between the hospital and the community. And then below, but not below ground, on the lower level, we have what we call the machine. And the machine is connecting everything. This is where we have operating theater, this is where we have intensive care, we have emergency, and we have imaging. We have all those functions that connect as a machine all the hospital, but they are not underground again. I will show you that. And then above that, on Thessaloniki, we have 2 levels. On Komotini, we have 1 level. And in Sparta, we have 2 levels again. This is where we have the wards. And the wards are actually floating in the trees. I mean, it's especially true in Komotini. I will show you. In Komotini, we're actually planting more than 1,000 trees. What happens is that, in reality, because of the level of those buildings, when you are in the wards, outside the window, you have nature, you have the trees. This is very important. Of course, in an hospital, number one is the medical excellence for sure. But also we need a human excellence, environmental excellence. And, having out of your window, when you are in the ward, having trees, the trees are a metaphor of a transformation in nature. And that is also true for medical care. Let's move on to the next image. This is showing one, I think this is in Thessaloniki, but this is basically the concept is the same. We have one very simple ambition, to make best hospital in this big country that is called Europe. And, making those hospitals in Greece make a lot of sense. And you understand why? Because Greece is a place where you know the importance of the kalos. Yes, you know the importance of the human quality. And this is part of the study. Of course, we have to start from medical excellence for sure, but thanks God, excellence is contagious. Thanks God, many good things are contagious, not just the bad things. We have also good things that are contagious. And, so medical excellence must be followed by human excellence, by environmental excellence, and light. I showed this picture, we have 1,000 pictures, but because the idea is that the ground level, especially ground level, you have to feel that light. We're in Thessaloniki, and because of the hill in Thessaloniki, we are looking south. So you see that you have that sense of infinite. Next one, please. I don't want to look romantic. Yes, I'm a bit romantic, but the reason I'm talking about that is because I know that all those things come together. This is a room. Luminosity, I was talking about luminosity. And I was also talking about the fact that outside the window, we have trees, always. We have trees in Sparta, because in Sparta, we are above Sparta, we are already in the forest. There is already kind of forest. We plant trees as well. In Thessaloniki, the same thing. In Komotini, we don't have trees. We're in the middle of the land, very close to Meleti. Meleti is a little village, not far from Komotini. And there we plant trees. But out of the window, we will have trees. And of course, trees will change, because they will be deciduous trees. So in the summer, they will be full of leaves. In the winter, will be less present. Next one, please. This is showing an operating theater. All the operating theater will have a view outside. I said before, they are in the lower level of the hospitals, but they are not in the blind. They are not in the dark. They are, by example, this is a picture of the operating theater in Komotini. And you have a view out all the time. Next one. Well, I don't want to take too much of time because we have a conversation here and that's more essential. But this is actually Thessaloniki. This is Thessaloniki, and you see the 2 levels. You see the trees. This is the ground floor. It's very important that on the ground floor you have this kind of a sense of transparency and connection with the city. I said before, it's for outpatient, it's for reception, for education, for everything that they connect to the community. And that is very important. Actually, here in Thessaloniki, we are not far from Filiro. Filiro is a small village there. And the connection between those little villages, Meleti in Komotini, Filiro in Thessaloniki, will be essential. Essential because, of course, there's a lot of connection, especially when you have to leave, you can leave the hospital to get low care in the village close by. So this picture is just showing that. Next one. Well, this is actually, I think this is in, this is Komotini. This is Komotini. I'm showing this because the sense of transparency, the sense of openness and accessibility is part of that. Of course, hospitals are not playground, but it's very important beside and essentially to the excellence of medical care. It's essential to create a sense of human well-being and the human connection. And one of those things is working on light. And now it's dark here, but we have done this building. And when you come in the day in this building, you see what working on light means. Light. Light is one of the most essential material in architecture. It's about the poetry of light. It's about the colors of the light. And that's the reason why I'm showing this. Next one. There's something I want to say about those hospitals. I said it's a great ambition. It's not a mad ambition. It's a possible ambition. But we want to be the best, and we want to make a hospital that put together excellence, medical, human, and environmental excellence. You see this picture is showing the roof of this. This is Komotini. Actually, we have the same thing on all the three hospitals. The roof is made of a solar panel to capture the sun, the energy of the sun. And this is what we have to do. We are working on this point, and we are aiming to be carbon-free. Being carbon-free means that we don't need the power. Of course, we need power for security, but we are trying to make zero emission. Zero emission means that we don't need to produce power. That's what we are aiming. We are not yet there, I know, but we are working on that. And this is very important because those panels up there make two jobs. One, they capture energy from the sun, and the other one create a better condition underneath, of course, because the solar radiation don't eat up the building, so we save energy on the air conditioning. I'm talking about that because, as usual, in the humanistic world, that is the one of medicine, you have to combine those excellence. You have to be perfect in terms of the medical science, but also we have to belong to the future of building. And making in Greece those three little hospitals, well, little, they are not that little, but those three hospitals, to become the living proof that you can make carbon-free building, doing this job. I think this is a great thing. I don't want to take more time than that. This is just what we have done. Here we have a model of those things. We have a lot of work done.
But before you go, maybe since you're also here, to open it up for any questions for us and for you, so if you can wait. So η ιδέα είναι ότι αφού μιλάμε για τα νοσοκομεία.
So as we're talking about hospitals, if somebody has a question that they want to put either to us as a foundation or to the government, the public, or towards Mr. Renzo Piano. So this is an open session for Q&A, and I'd like to add that it's important for us, even though these hospitals are not located in Athens, and today we're in Athens, to hear whether what you heard is satisfactory to you, what you would like from a hospital. So these are general questions, but we're here in order to talk about it. This is the moment. In 5 years' time, these will be up and operating. I prefer to be seated. Is that okay? Yes. Yes, because I'm not so used to speaking before an audience, and it's a bit difficult for me to stand up. So, first and foremost, I was very pleased that you actually talked about the nursing staff and you showcased them. I have experience from nursing abroad, and I see that the nursing staff does a lot of work, and they also do more work than the doctors do. So my question, therefore, is this nursing staff that you're putting so much importance to, it's known in Greece that there are certain problems here in Greece because in the countries abroad they are trained at university, etc. So how are you going to achieve the quality of nursing? So I think that the problems in the nursing staff are worldwide, not only in Greece. So one of the reasons, I'm referring to Greece, that's why. One of the reasons is that they're not remunerated as they should be, and that's another aspect of the discussion. We're not the state, so we do not replace, we supplement and complement. What we're trying to do is to try and ensure that they have better training, to open up the horizons and see what is happening abroad, to see what is done abroad and is best practice, and to bring it in Greece, and to train them on the equipment so that they can become better. From there on, this is part of the Ministry of Health and the overall efforts with hospitals and education in order to have a better nursing staff. So you are, in fact, offering a good education. Well, you're saying as if it's a good steak or something that you eat. So what we are doing is we're providing additional training, we're giving infrastructure, and this also has a multiplier effect. And as Renzo said, that excellence is that we are able to relay it. So we can't go from one to the other. It goes, in fact, upwards. It's contagious. Can we have miracles from one day to the next? Yes, we can. So you are experiencing a miracle right now. I agree completely. And in very difficult years, it's true. So the cooperation was a miracle, yes. So a second question, if I may. So you are actually offering to Greece, that has in fact gone through trials and tribulations in recent 10 years, the last 10 years, amazing equipment, high-tech equipment. These need people who have been trained to use them. They need continuous maintenance. When I pass outside of Yenmadas Hospital in Mesoyeon Avenue and I see the mobile mammogram units, we see that in the summer they are really under a scorching sun. So what's the question? The question is, I would like very much these machines and equipment to not have the same fate, but I imagine that you're clever as a foundation and you'll ensure that they will have a better fate, because I'm very sad when I see this. So you can be less sad from now on. So I'm going to ask of Panos to say things very briefly. I'll say with respect to the linear accelerators, as we said, we gave 9 to public hospitals and 2 to the military hospitals. It's important, and I don't want to be long-winded. So the preliminary work undertaken in order to choose where we would go, and the preliminary work at a hospital level in terms of infrastructure and in terms of staff that would handle the machinery. So, of course, we know that there are efforts that are undertaken in order to improve things. So, Panos, can you say a few things with respect to linear accelerators, because I think that the process is important. I would like to also say that also in the grant of the linear accelerators and in the ambulance grant, maintenance was included. So this was a comprehensive grant. With respect to what Mr. Dracopoulos said, there's a lot of hard work behind. We do our preliminary work, and this is ourselves and advisors from Greece and abroad. And this is part of the design. And this is also at hospital level, and the spaces. We try to prepare the space. We don't talk about the infrastructure alone, but also the existing and new staff is prepared so that they can welcome things better. So I think that this is a very apt question, but I'd like to say that it's done actually gradually. And a third question, no, finally. I don't consider anything to be a given fact. I'd like to say thank you for what you've done for Greece. Thank you also. And which we have felt has done us the world of good in these difficult times. Any further questions?
Κύριε Πρόεδρε, κύριε Πρωθυπουργέ, κύριε Υπουργέ, σεβασμιότατε, καλησπέρα. Νιώθω την ανάγκη να μιλήσω για δύο λόγους. Πρώτον, μπράβο και συγχαρητήρια που συνεχίζετε και με τους ρυθμούς αυτούς. Και πραγματικά ήταν μια ιδέα δικιά μου και του Ανδρέα ότι αντί να ξαναφτιάξει τον Ευαγγελισμό με 200 εκατομμύρια από τα πατώματα μέχρι απάνω, να ρίξετε αυτά τα χρήματα που από ό,τι βλέπω μεγαλώνουν στο να φτιαχτούν αυτές οι υποδομές συμπληρωματικά σε πράγματα τα οποία είχαν ξεκινήσει τα προηγούμενα χρόνια. Πρώτον, να μην φοβάστε, κυρία μου, ότι δεν θα λειτουργήσουν. Οι γραμμικοί επιταχυτές, προσλήφθηκε όλο το απαραίτητο προσωπικό και λειτουργούν σήμερα. Και οι γραμμικοί επιταχυτές από την δωρεά του Ιδρύματος Νιάρχου και αυτοί που μπήκαν μέσω ΕΣΠΑ ή μέσω Εθνικού Πουδουέ που βάλαμε τα προηγούμενα χρόνια. Και έχει υπάρξει και ολόκληρος προγραμματισμός για αυτά. Εγώ θέλω να κάνω δύο ερωτήσεις, οι οποίες είναι σημαντικές. Και στο μνημόνιο που υπογράψαμε και στην κύρωση της σύμβασης και στις πρώτες εκτελεστικές συμβάσεις που υπογράφτηκαν μετά, είδα κάτι να λείπει εδώ. Και δεν μ' αρέσει που λείπει και το λέω έτσι. Δηλαδή, 4 μηχανήματα εκπομπής ποζιτρονίων, 4 PET, θα μπουν σε 4 πανεπιστημιακά της χώρας. Μαζί με αυτά, είχαμε κυρώσει τη σύμβαση ότι θα έμπαιναν και 4 κυκλοτρόνια. Δηλαδή, μηχανήματα παραγωγής ραδιοφαρμάκων. Και αυτό απευθύνεται και στην τωρινή πολιτική ηγεσία. Ήδη 2 μηχανήματα, το ένα τοποθετείται στο Γενικό Ογκολογικό Αγίων Αναργύρων. Από τη χρηματοδότηση της Περιφέρειας Αττικής, Επειραιώς Ναζιδούρου, ξεφορτώθηκε πριν από μια εβδομάδα. Και έρχεται και το επόμενο στο νοσοκομείο Μεταξά. Η λογική που είχαμε πει στο Ίδρυμα να συμβάλλει στα υπόλοιπα είναι ότι εδώ και 7-8 χρόνια και 10 χρόνια πληρώνουμε πανάκριβα το ραδιοφάρμακο διότι έχουμε μονοπόλιο. Που ο οποίος μας το έδινε και το δίνει μέχρι πριν λίγο καιρό 700 ή 800 ευρώ τη δόση, όταν οι Ιταλοί και οι άλλοι το αγοράζουν 150 και 100 ευρώ και 180 ευρώ. Μόλις μπήκαν τα κυκλοτρόνια, έριξε την τιμή. Έμαθα ότι πήρατε μία επιστολή, η οποία λέει ότι δεν μας συμφέρει πλέον, γιατί έπεσε η τιμή στα 450 ευρώ από ό,τι έμαθα με τη διαπραγμάτευση που ξεκίνησε από την ενημερώ μας και ολοκληρώθηκε τώρα από τον ΕΟΠΗ, ότι δεν θα μπουν τα κυκλοτρόνια. Λοιπόν, θερμή παράκληση να μπουν τα κυκλοτρόνια. Εάν δεν μπουν ή μπουν μόνο τα 2 από την περιφέρεια, τότε σε λίγο καιρό, όντας μονοπόλιο, θα ξαναακριβύνει την τιμή και θα πληρώνουμε τζάμπα κερατιάτικα όπως κάναμε μια δεκαετία. Αυτή είναι η μία ερώτηση. Και κάτι άλλο, πάλι σε μια απάντηση, χαίρομαι πάρα πολύ που το πρόγραμμα το ETLS και με τη δικιά σας χρηματοδότηση, αλλά εδώ θέλω να πω κάτι και στην ηγεσία του Υπουργείου Υγείας, που είναι ένα εξαιρετικό πρόγραμμα, που εκπαιδεύει, που θα το κάνουν όλοι οι απόφοιτοι της ιατρικής που το θέλουν τώρα και θα μπορούν να αντιμετωπίσουν ένα τραύμα εκεί που θα κάνουν αγροτικό ή στην αρχή της ειδικότητας, ότι μετά τη λήξη αυτού είχαμε δεσμευτεί ότι θα το αναλάβει τη συνέχιση μέσα από χρηματοδότηση το Υπουργείο Υγείας, από το αποθεματικό του Υπουργείου Υγείας, 12 εκατομμύρια τουλάχιστον είναι κάθε χρόνο το αποθεματικό του, μπορούν 1-2 εκατομμύρια να διατίθενται για τη συνέχιση της εκπαίδευσης στους φοιτητές ιατρικής στους αποφύτους αυτού του πράγμα. Ευχαριστώ πάρα πολύ.
Λοιπόν, ερώτηση ή απάντηση. Ναι, να το βαστίξω λιγάκι για τα ΠΕΤ. Θα να πεις, Γιάννη, για τα ΠΕΤ. Γιατί και πάλι, να πούμε, εμείς δεν είμαστε ειδικοί. Γινόμαστε ειδικοί γιατί μαθαίνουμε. Αλλά το πιο σπουδαίο είναι ότι συνεργαζόμαστε και ακούμε. Και τα πράγματα αλλάζουν. Και δεν είμαστε τέλειοι. Λοιπόν, έχοντας πει αυτά, δεν ξέρω την ακριβής απάντηση για το πρώτο. Αφήνω τον Γιάννη που έχει ασχοληθεί πιο πολύ να απαντήσει. Και για το δεύτερο δεν νομίζω ήταν ερώτηση.
Όχι, τοποθέτηση.
Εντάξει. Υπενθεί, εντάξει. Συνεχίζουν. Τα έχουμε, είναι ήδη δρομολογημένα. Για το πρώτο, λοιπόν, Γιάννη.
Λοιπόν, ισχύει ότι λάβαμε αυτή την επιστολή, η οποία λέει ότι μειώθηκε όντως το κόστος. Μαζί συζητούσαμε ότι ο λόγος που ξεκινήσαμε αυτή τη δωρεά ήταν τα 700 ευρώ. Πλέον δεν είναι 450, είναι 350 ευρώ η δόση του φαρμάκου. Ξέρουμε πολύ καλά, το είχαμε συζητήσει εκτενώς, ότι είναι δύσκολη στελέχωση. Δεν ήταν αυτό το πρόβλημα όμως. Όλα βρέθηκαν, όλα ήταν εκεί. Θα σας δώσω το λόγο, Μάρια. Όλα βρέθηκαν, όλα ήταν εκεί, όμως η μείωση, η δραστική μείωση στο 3,50 που είναι σήμερα, δεν μπορεί κανείς να προβλέψει το μέλλον. Αν θα ξανανεύει η τιμή του ραδιοφαρμάκου επειδή ακυρώσαμε εμείς τη δωρεά. Αλλά σήμερα είναι 3,50 και ξέρουμε όλοι μας, τουλάχιστον όσοι έχουμε ασχοληθεί και εγώ τώρα το τελευταίο διάστημα, ότι αυτή είναι μια πολύ καλή τιμή και όχι μακριά από την τιμή που το ελληνικό δημόσιο θα πετύχει. Οι τιμές 200 ευρώ και 150 που πετυχαίνουν στο εξωτερικό είναι γιατί έχουν μεγαλύτερες μονάδες ραδιοφαρμάκου και μεγαλύτερες ποσότητες. Με αυτό εμείς σαν λογική και παίρνοντας και την εισήγηση από το Υπουργείο Υγείας, συμφωνήσαμε στο να εξαιρεθούν τα κύκλωτρα από τη συγκεκριμένη δωρεά. Τώρα, αν στο μέλλον ξαναγίνουν 700, δεν λέω ότι εμείς θα ξαναμπούμε να βοηθήσουμε, αλλά πιστεύω ότι κάποιος θα αντιδράσει.
Θα μπει ένα άλλο ίδρυμα και θα βοηθήσει.
Πιστεύω ότι κάποιος θα αντιδράσει.
Να πούμε και κάτι άλλο, ότι ειδικά και στο...
Particularly in the health sector, many things change. One of the biggest problems is in the hospitals. Things change. Now we will have one big ICU. A lot is changing, so we can't know for sure what's going to happen in the future, but we're doing our best given the things that we know. We do our best. We try very hard. Mr. Pisakas, Marios. In relation to what was mentioned by the minister, you've covered me. We talked about the drop in the price of the radio tracer. This was not done in a magical way with a magic wand or because something was adopted or voted. So, of course, we see that back then there was 700, but since then 2 more units have opened up and another unit will be opened up. So we will have so many units in Greece and the price is 350 now. So if you look at the cost-benefit analysis and the money that will be provided by the SNF, by the Greek public and the staffing, well, I think that it was not good in the interest of the Hellenic Republic to keep all 4 cyclotrons, excuse me. So we here again, I'm going to talk about oncology and radiotherapy and the revolution you've brought about in this country. Everything has changed when it comes to radiotherapy. The 10 linear accelerators that are all operating, they're the best models that have ever come to Greece. The state of the art, if you like, in their category. It's cutting edge. All of them are operating. And what Mr. Renzo Piano said previously, meaning how you take care of your patient. If you look at the aesthetic of all these linear accelerators, you'll see they're beautiful, marvelous. And when a patient actually goes into a radiology unit, they feel overwhelmed. But what you've done with the grant is really amazing. When we started, we first talked to Mr. Vanzeos, and out of the 24 linear accelerators, 16 were almost 15 years old, 70% thereof. And now we still have 7 old linear accelerators. So I appeal to you. I know the state is good, but please continue the grant. Continue the grant. And I think the collaboration, the partnership is excellent. And I'll leave it at that. Thank you very much. Thank you. All this has happened thanks to the very good partnership we have been able to achieve. And the patients have benefited a lot. And we see that the quality of life after such a difficult treatment, well, they're the only ones that should benefit. Any other questions? And then we can proceed.
My name is Thanasis Katsikidis. I'm here. I'll stand up. Thanasis Katsikidis is my name. I've just finished my studies and I was involved in the issue of health policy. I'd like to thank you for what you've done with respect to health, but I want to ask about 2 things, and I want to know about the status. Are you going to build them and you're going to hand them over the state, and then you're going to take over the maintenance in order to make certain that there won't be shortfalls? So you're going to deliver them and then you won't have any relationship with them, correct? And second, do you have in your plans for the future a hospital which will be either in Cyclades or the Dracopoulos, where there are also a lot of shortfalls, especially in the islands where the medical centres are not working up to par. So I am from Tinos, and we see that there's a lack of health services there. So the answer is that at the moment, no, but we are listening to see where there are shortfalls and where we can help. When it comes to the islands and the villages, it is there that we have the NGOs of Regeneration and Progress, and Mr. Kouloubas, who spoke before, with medical mobile units. And Dakis, I think you should tell us what the medical mobile units encompass, because there's a full medical test and then there is continuity. So it's not only a matter of having the best possible hospital, but we also have the medevac, or the ambulance services. We have the new helicopters, we have the new airplanes, we have the 143 state-of-the-art ambulances. All of these help us have the appropriate infrastructure. So education and training people, air ambulance services, all of that, in fact, helps and brings it up to a better level. So would you like to take it from there? Yes, the medical mobile units is a program that wants to actually cover the existing needs. We haven't gone to Dinos because there doesn't seem to be a need. We have two, in fact, mobile hospitals. We have state-of-the-art equipment, and we have the experienced doctors at Lego actually take in the patients that need help. And we've gone in 3 months from the mountainous areas of Evros-Rhodope to Castellarzo, where we were 2.5 weeks ago. So we've covered more than 28,000 patients, more than 60,000 clinical tests, and we've provided 3D mammograms, and we have a registry for all the women in the Aegean for mammograms, for pap tests, and dentists, and they even have implants, and we have small surgeries wherever we've found ourselves. And the aegis of the Ministry of Health, we always inform them when we're starting out, and Mr. Polakis knew it in the past, and the Ministry of Health knows it now. And we have a secretariat 12 to 4 where people can book their appointments if they have a special need. And if we've left the island, in 6 months' time, we have a smaller team that goes with an eye doctor and cardiologist, 2 specialties that patients want to consult, and there is the e-file. And we have actually been 3 times to each island. You understand that there are a lot of data, and we are starting a major research initiative in order to have a biobank, and that means that we have a family map of families that have cancer, and we are creating a blood bank in order to have medical research in the future. So this has been done for the last 6 years. It's done from volunteer doctors. They actually give us 3 weekends plus 1 day. They devote time away from their families. So we have, in fact, people in Samos that want to go to Furni, and 2.5 weeks ago we were in Castellarzo. And I must say that it's very worrying that we have a 40% reduction in the population of people who live in the islands. So we must say in the questionnaire, they actually say that they're satisfied to remain there and happy. Thank you, thank you. So I'd like to say that the answer that we had might have been no, but we see that we are building different ways and facilities to support the actions with respect to health. Anybody else? A question? And we will continue. And because we have Renzo with us, and he spoke about the hospitals, if there's a question, shall we talk about the hospital-related questions from Thessaloniki? We're also grateful for the hospital that's going to be built now, and especially with respect to a grant that's already happened, a digital angiogram in the Ahepa hospital, where there is also going to be maintenance for the next 6 years. But because you talked about us being a chain, yourselves, the government, the staff, and the relatives, perhaps the link of the Ministry of Health should be reinforced with the consumables for these very expensive equipment to work, because we know that the budgets are specific, and with the lack of funds, they are not working up to standard or as effective as they have, or as many shifts.
The easy answer would be yes, we'll look into it, but the truth answer is we don't replace, we complement, and there are certain possibilities. We're not a pit where, everybody can take something from. Money has its limits. I have a question too. Go ahead. Saridaki is my name. I'm an oncologist. I wanted to ask something in relation to the 3 new hospitals. If you have a plan next to them to build some cultural units or different hubs, culture hubs, because apart from medical excellence, what is important for patients, for doctors, and for carers to have cultural excellence as well? So, yes, but. I agree with you, but. A lot can be done, but there's Wakanda as well. Wakanda has everything. Lovely ideas. We do our best, but there's a lot. That we're being told. Good afternoon. Your Beatitude, Minister, President, dear friends, I'd like to thank you as a Greek citizen. Thank you for what you've offered us. But the issue of health is a huge one, and it's a timeless one, and solutions are very small compared to the large problems that we're called upon to encounter. So let's say that somebody comes, serves for a year, but the problem remains. And the big problem is not just administration and the trade unions and the fact that we don't have evaluation of staff. Unfortunately, this is the truth. But the problem is that we have a non-anthropocentric healthcare, because the doctor and the nurse do not see the patient as a man, they see him or her as a case. But we can't cover that. So what's the question? You can't do this, but what's the question? This is not the health policy alone. This is a global issue. It doesn't only concern Greece. It's got to do with how we live. It's got to do with the philosophy of the governments, the philosophy of the people. This is why I talked about sustainability, of being human and humane. This was a short introduction, but the way the system works now, the selection of the board of the administration is not the best one always. And sometimes your creation, if you like, will actually just become part of Greece, and it will be just like everything else is. And it would be terrible to have cancer patients without a punch biopsy. It would be terrible to have private individuals, for example, working along with it. So we have to protect public health, because public health is suffering a lot. And we know that Greeks are insecure when it comes to their health. And the question is, when the mechanism in place has directors who cannot implement the law and who do not have the strength to apply the law, how will you continue to create lovely buildings which will then just become like all other buildings in Greece that are run by the public sector? Well, don't make me drink. Anyway, so I think that the same questions were asked in relation to the SNFCC, and they would say, you're giving it to the state? Are you crazy? But look, 3 years have gone by and it's operating. We're helping. We will always help, provided everything is done correctly in the right manner. So we all have to pitch in, but we have to stop looking at the barbarians. We must all help. We can't just criticize. I believe in the role of the state, and there are good people working in the state. So what we need is good partnerships. This is our role, a supplementary role. Now, let me add to what you said. You go to a hospital and the doctors may not treat you well. This doesn't mean that they're bad people or that they don't do their job properly. They're tired. There's very few of them, but they're all there and they all do their best. they all do what they can. Our experience from the partnership we've had so far, from the collaboration, doesn't actually show what you just shared. And I agree with you that when somebody has worked for 20 hours, these people may not be that polite. And at the end of the day, they're very competent physicians and nurses out there. So 2 more questions, and then we will stop. And if you have a question addressed to Mr. Piano, who's with us from an architectural point of view or philosophical point of view, you can ask both types of questions. So I'd like to congratulate you for your anthropocentric architectural approach. Having looked at hospitals and dealt with hospitals, I know the big difference that one can see from one extreme to the other extreme, and I know how important this anthropocentric approach can be. It can affect one's psychology, and it can help in the healing of a patient sometimes. It's good in the treatment of a patient. Mr. Renzo Piano said in the wards, the patient's wards, there will be the possibility of a folding bed, a camp bed, where, for example, a carer can spend the night in the room with a patient. But I'd like to generally ask, to what extent does Mr. Piano see the other infrastructure, like the hostels or different places where carers can stay in hospitals? Because these hospitals are addressing a wider region. They're catering for a wider region because people are brought in, and sometimes carers and their family, their loved ones of the patients, find it difficult to find a place to stay. So what about the accommodation of the carers, of the patient's family and relatives? Where can they stay? Could they possibly stay in the hospital or somewhere nearby? Let us not have a misunderstanding here. If a hospital is done properly and it actually respects the patient, it doesn't mean that it can offer accommodation to relatives.
That's the reason why I was talking about Fidiro, that is very close to Thessaloniki, and that's the reason why I was talking about Meleti, that is a little village close to Komotini. And actually the Sparta Hospital is so close to Sparta, the little town. So it's essential that there is a connection between the environmental structure of the country and the hospital, especially because we, of course, as you know very well, this is medical. We try to reduce the length of stay in the wards of the hospital, just trying to keep this for the intensive care, and then we try to make a low care, of course, in the separate situation. This is one of the reasons why those buildings are created in a place where they can connect to the other thing that is very important, talking about culture, is of course that education is part of those hospitals. And this is very important because education is a part of what we call culture, and it's about society, is about participation, and this is also part of the study. I was very touched about the conversation and try to understand, but you know, I understand that making such kind of things like those 3 hospitals, it's something quite small, that like a drop, but you understand that drop matter. Drop are very important, depends from the drop, but you know, in this crazy world, we will never make it better by trying to change everything. We do our best. I know that doing those 3 things is not going to solve forever the problem, but I think they will be a good example of how we can make a better place for medical care. Of course, that's the reason why we're mixing so much in this conversation medical science and human science and environmental science. I was even talking about kalos, because kalos is a Greek word. It doesn't exist in other language. Well, in my country, Bello is quite close to Kalos. And Kalos is something that has to do with this idea that beauty. Don't forget that in this country, the first hospital was called Asclepion. And you know better than me what the Asclepion was. The Asclepion was just a place of serenity and beauty, when the medical science didn't exist yet. So, of course, again, I'm not mad. I know that medical science is the number one, but what we are trying to do here is to introduce the vastity of the experience. So in that vastity of duty that we are trying to, we can do as much as we can. We will not solve the problem. We will not change the world, but for sure we will make a better hospital, for sure.
Thank you, Andrew.
Thank you.
Μια τελευταία ερώτηση για τον κύριο Πιάνο.
One last question to Mr. Piano, because then we have to continue. A question addressed to Mr. Piano. My name is Geroulakos. I work at Attikon Hospital. This was built without parking space. And if you go to this hospital, you will see a lot of traffic jams in all the roads leading to this hospital. So the question is, in relation to the architectural design, have you foreseen a parking lot for the patients who will be visiting their loved ones staying in the hospital? I'm particularly talking about the hospital of Sparta, because it's 5 kilometers outside Sparta, and we know that a lot of people will have to go by car, their private car. So we agree, we've looked into it. In Thessaloniki, there is an empty plot opposite the hospital, and together with the ministry, we said that this would become a parking. So yes, the answer is positive. There's a place for a helidrome with the air ambulance services. So the answer is all the parking needs have also been taken into account. I thought in the beginning that you would tell us to build a parking lot for Attikon Hospital, and I got scared. Renzo, thank you.
Thank you.
Renzo, you can take this. You can take this. Sure.
Λοιπόν, επειδή έχουμε και πάλι λιγάκι...
Well, let us now say about Evangelismos. We all said that we have started by Evangelismos, or with Evangelismos in this initiative. So I'm in a very pleasant position to say that Mr. Rusos, who was in fact the person who helped us launch this entire effort, came back because he's very good at reverting or coming back. And he said that the ICU and the emergency department require renovation in Evangelismos. Our response was that after the budget that has gone from 200 to 420 million, we are stopping. We cannot go further. We cannot add more money. After pressure and thought, we looked to see whether we could find others who would like to collaborate with us as donors in order to cover 3.5 million euros, so that we could bring about the renovation that we wanted in the emergency and ICU. And we said that if others would come along, that we would also help, because we believe, and we say this loud and clear, that if others actually toe the line, we will come and give a helping hand also. So there is amongst us in the argument, in the audience, or Mr. Thanasis and Mr. and Mrs. Thanasis Martinou, please rise so that people can see you. And Mrs. Aliki Peroti. Whom we'd like to thank. They immediately responded in 48 hours' time. And I'd like to simply say that Mr. Thanasis and Mrs. Marina Martinou have in fact worked in philanthropic services in health also, and they have actually provided a lot of grants to the Esclipio in Vula and in the Attikon. Hospital and in Evangelismos. And they're going to contribute 1.5 million, and $500,000 will be provided by Mrs. Aliki Verodi, who's also been a volunteer in the Children's Hospital of Hagia Sophia for more than 15 years. She has contributed a lot in memory of her parents in Konstantopoulou in Neo Ionia. She's helped the renovation of the Naval Hospital, and she has given a lot of money to the farming school, the American farming school in Thessaloniki. And these are two families that have been great benefactors, and we'd like to thank them. And thanks to them, they are going to help us give more also, and we will see that Evangelismos Hospital is going to be the hospital that stands to gain from this. So this shows that the force of collaboration can in fact affect money levels if we go about it correctly. Now I'd like to hand over to Yannis, and he's going to talk about supplying and installing the medical equipment. We've talked about this before. I think that what remains to be said is that we've been working in order to provide these 4 pieces of equipment to Ioannis Larissa Iraklio in the 1st of January 2021. We also talked about the air ambulance services. We're talking about 2 new planes and 2 new helicopters. They're going to be delivered in September and October 2020. The 2 helicopters, rather, and the airplanes until April 2021. Yannis, did you want to add a bit more to that? Yes, the initial grant provided for purchasing 2 new planes and the repair of 2 existing helicopters from amongst that in the EGAV fleet. But after we spoke with the leadership, with Mr. Kikilias and the Ministry of Health, we agreed that we would go forth and extend the grant by 1.4 million and to buy 2 new planes and 2 new helicopters, and we agreed that the full maintenance for the years to come would be undertaken by the Greek state. So these photographs that you see behind us are not shown in order to show the existing state of affairs and say, look at the next photograph that shows how good the new airplanes are. But we'd like to show you these photos more in order to show that the Greek state, even though it did not have means, it used through the Hellenic Air Force its means, and they tried in a short period of time to transform them into ambulances to evacuate our fellow citizens from the islands. And I think they merit congratulations, because they could have in fact not done that. So this grant is not going to add something. People were evacuated, but it will in fact enhance the quality of these services, and you'll see how these people are going to be transported and will drastically reduce the cost. It is very costly to actually have a C-130 go and collect somebody, but that's not going to actually put into the equation. But this will be greatly reduced with the new helicopters and planes, and I think that the annual cost of budgeting will be below 50%, because we will purchase these airplanes and helicopters. Mr. Piros, who is the medical director of GAV, will say a few words. Good evening. We heard about the hospitals, and we have also heard the phrase, we're going to go to the hospital. Unfortunately, for some patients in the worst moment of their life, they cannot choose either the means or the person that will actually take care of them. And this is the role of EGAV with the ambulances, and we'd like to thank you for the grant. The role of EGAV with the airborne means, and the change is exactly what you've just said. We have been doing it since 1994, and we did it throughout the crisis also. We're going to continue to do so, but under much better conditions for our patients. These conditions, however, are improved not only because of the equipment, but also the contribution in terms of training with a PhDLS. And I want to actually combine the machines with the training so that the patients in the most moment of their life where they can't choose either the means or the doctor will have at least the best possible solution. Now, I'd like to add something, if I may. It has been said with respect to public-private sector partnerships. There is, however, another cooperation that has taken place for many years, and that is between the civilian and military arms or sectors. And I'm talking about the contribution of the military, especially of the Air Force in the med-evac services. So we see that the public sector doctors, together with the pilots of the military, do more than 200 medevac missions a year, and thanks to these new means we're going to do them better and faster.
So let us now continue. We're talking about the nursing sector enhancement or support. We talked about it, and the educational programs and the support of research programs and provision of scholarships for the nursing units, both in Evangelismos but also at ECPA, the National Capodistrian University of Athens. We have with us Mrs. Limonidou, who's from the nursing department, and Mrs. Kotanidou from the medical school, and she's responsible for the postgraduate program at Evangelismos. This is for nurses, students of the nursing department. So tell us a little bit more about these educational programs and how this will help you, how this improvement will be brought about. Hello from me. Before saying anything else, President, a warm thank you to you and your associates for the biggest and best grant ever made for the nursing sector in Greece. It is not an exaggeration for me to say that this is a very important day for our university, particularly for the nursing department, because, as was mentioned by a lady previously, the truth is that the conditions for the nursing staff are very difficult. There have always been difficulties, even when it came to training and education. Things have changed. We've made strides. Our department offers very good services. We have educated and trained many students who are now starting to staff the hospitals. The graduates of our nursing department are still very few. And as you said, with the renewal of the equipment, with the different educational programs and the scholarships that you will provide, we believe that our nursing department will become a research center, a center of nursing excellence. And in this way, we'll be able not only to better fulfill our educational role, but also our social role. Because, as you know, whatever's done in the nursing sector is something that is given back to the patients. So it's given back to society. This is why we consider your grant so important. Let me also point out the very good collaboration, and not only in the context of the Special Advisory Committee, but also the special meetings we had with your associates at our department, the nursing department. Could you please tell us, but let me say that nursing has a very important role to play, because when we looked at Evangelismos Hospital, and I didn't know, I found out Evangelismos itself had a special nursing school for male nurses and female nurses. And then we ended up not having our hospital. We may have had the nurses, but not the hospital. So it's done a lot of things. There have been a lot of firsts. And let me tell us your experience to the Johns Hopkins Hospital, because you wanted to see what excellent conditions can be found. Well, let me say, what can I say about Johns Hopkins? I don't know when we'll reach that level to have the magnetic hospitals, to only have university graduates working there as nurses. So there, everything is self-evident, but we're still starting, we still in the beginning. So how can you make use of the experience that you had? So we're talking about the simulators, the simulation. There's always a problem in the practical training. We know that we don't have university graduates working as nurses in most hotels. So simulators can play a very important role, and they can replace clinical practice, clinical training. So I believe that the grant is very important, and this is something we saw at the Johns Hopkins. We saw that the whole hospital there only had simulators. It was fully equipped with simulators. This is excellent, and I think that the best equipment are the simulators. We didn't have them. Thank you very much. Mrs. Kotanidou, you have the floor. Yes, I'm here. I'm over here. Oh, hello. Hello. I would also like to warmly thank the SNF for this great grant to Evangelismos Hospital. As you said, the first nursing school was established in Evangelismos. This nursing school in Evangelismos for many years followed a tradition. All trainers in the nursing school had postgraduate studies abroad, even though back then there was no simulation. So we went and did the training by the patient's bed. And what's important for the good operation of a hospital is to have a good nursing staff and a good nursing department. Otherwise, we really don't offer quality services. And what we saw at the Johns Hopkins Hospital is that their nurses close to the patient 24 hours a day. There are many nurses. They've received very good education. There are nurses that are even better than most doctors. And I'd like to say that the nurses could carry out some interventions. They could prescribe drugs, medication. So they were nurses/doctors. And I think that what will really benefit nursing in Evangelismos, but also in other hospitals, because these units that will be created in Evangelismos are not just for Evangelismos, it's for nurses from all over Greece. Whoever wants to do the postgraduate courses or the different seminars in the simulation centers can do so. So the educational programs and the simulators we saw at the Johns Hopkins Hospital were very interesting. All this was very enlightening. And I believe that with this collaboration, it doesn't have to be in situ, but this can be done with webinars. With webinars, we can do our work. We don't need to go on the spot and go to Johns Hopkins. So thank you. Let us continue 2 more programs, and then we'll open the floor again for questions. One has to do with the infections, the hospital infections program. Theoklis will talk to us about that, and treatment of trauma. Takis will talk about treatment of trauma.
Now, as you all know, the nosocomial infections are a very important problem in Greece and worldwide for that matter. And official data. Sorry, Theoklis, would you like to say your full name and where you are? Sorry, my name is Theoklis Zoudis. I'm a professor of infection, and I'm the head of infections in the Children's Hospital. So the official data from the EU show that 1 in 10 Greek patients that go to hospital suffer from nosocomial infections. Most of these infections are from resistant microbes that cannot be covered by our antibiotics and cannot be treated. All patients are at risk of nosocomial infection, but the ICU units are especially at risk and those who are immunosuppressed. Now, what are the repercussions? Nosocomial infections actually influence mortality, morbidity, and have economic repercussions because it shows that they, in fact, extend the stay at hospital. And in literature, we've seen that over 50% might be prevented by certain key practices in terms of prevention. Can you actually focus on this on how this program will in fact help address nosocomial infections. So this program is a public-private sector partnership. Will focus on creating a digital monitoring stewardship program so that we can all talk about the same thing in the same way, and in actually having education trainings in order to help prevention and tackle the infections. Now, Dr. Koulouvaris will talk about trauma. Well, trauma, for those who are not doctor, is in fact the first cause of death of young people under 45 years of age, and it's also the first cause of death and handicaps. So we see that more than 800,000 patients with handicaps as a result of trauma. So we started a pilot project in 2016 after Professor Andreas in Patras is the first who brought ATLS in Greece in 1992, and we had to convince the US to give us for our graduate students. And so we started in the Attikon Hospital in Patras, and in 2 years we had 567 students trained in it with great success. And then what did we think? We thought how we will actually escalate this. And the first phone call was with Rector Dracopoulos and the head of the medical sector, Mrs. Figaikis. They're both internal medicine doctors, and they said that we were going to open it up to other students, but also for all universities. And the head of the medical faculty actually talked to all the universities. And then we said the emergency services, and we said that we were going to actually go to Chris Hani, and we wanted to start with the people who were in charge of the emergency service. And we were interested in going to the rescue staff so that we can go to them in the golden first hour and to actually help these multi-trauma patients. So we have, in fact, certified programs which have been certified from the US for the graduate students of medical school and nursing school. And we have, in fact, for ortho students and for the nursing staff. And we also have scholarships where we send them to doctors to South Africa, anesthesiologists, orthopedics, and they're going to go to the best trauma center there. And I'd like to give the floor to Mr. Diani to explain why in Africa.
Why in South Africa? So the hospital that the doctors will go to, thanks to the SNF, is the biggest hospital in the Southern Hemisphere, and it has 3,200 beds. And the trauma unit is the biggest trauma unit in the world. Now, there are two countries which register the trauma surgeons. One is the US and the other is South Africa. So you might ask, why don't they go to the US and go to South Africa? I'll tell you two reasons. Firstly, because the Americans in trauma are better than South Africans. The opposite, excuse me, the South Africans are better. But the second reason is you go to America and you say, I was trained in America, and it sells more. But when you go to America, you don't become registered, meaning you're not registered as a doctor in order to do practical training. You're just an observer. And it's not nice for you to put it on your CV without having, that is, acquired experience. The right thing is for you to operate when you go somewhere. So in South Africa, when the doctors go, they operate, they have the same obligations that the other doctors have in the unit. They don't choose what to do. If they have to do something difficult, if they have to be on duty, they do whatever else does. So you might say the first time that this is happening is with Niarchos Foundation. Is it the first time that this has happened with the Niarchos Foundation? No, it's happened in before, and the Niarchos Foundation, the Niarchos Foundation grabbed the opportunity with the doctors who went there and the administrators of Niarchos, and they had the opportunity to do the same thing. So we started with the military doctors, military surgeons from Germany, 19 years now, every military surgeon in Germany goes to our hospital and South Africa, and they learn not only how to deal with road accidents, victims of road accidents, but people who've been shot and people who've been stabbed. And in Europe lately, we see that there is an increase in these types of penetrating traumas. So we had the German military surgeons that were first to come to our hospital. Then we had from Finland, we had some doctors, and then we also had the Society of Surgeons of Spain, who've also come to our hospital. And let me also mention one more thing, and this actually shows how good it is an idea for Greek surgeons to come to South Africa. So let me say that the biggest trauma unit in Boston, the Massachusetts General, sends doctors to South Africa, and they do part of their trauma training there. And the time they do trauma in our hospital is the time which is recognized for their trauma training in the US. I think this says it all. I don't need to say anything else. I rest my case. So there's constant monitoring, there's supervision. Doctors don't go to killing fields. There is mortality that is recorded. Everything is noted. And medicine, when it comes to trauma in particular, it's very high. And I think that it can only benefit Greek surgeons who come to South Africa. Thank you.
I'd like to add and say that after the 5 years that have been undertaken by Stavros Niarchos, the Greek state is going to continue, and that is a blessing. And they have actually agreed to continue all programs. And Mr. Andreas, who's 40 years in the program, he's the first who brought it. Professor, you're there. Could you tell us a few words about your experience, about your students who actually are trained in the last year, and in the US they try to do that also for their students? We're talking about trauma. And those who are of a certain age know that trauma was neglected. It was considered to be a disease or a fate, if you like. But in 1996, the American College of Surgeons considered that trauma was, in fact, a surgical disease, and it proved it. And I'd like to say that everything began because up to 1980, each doctor faced the patient with trauma as he saw fit, as he best knew and as he best believed. Everything changed when an orthopedic, Dr. Steiner, was flying over Nebraska, and his plane fell. He was injured, and his children also, and his wife died. And a year later, he declared that my children and I were actually taken to a local hospital, but I was able to give better help to my family on the site of the injury than at the local hospital. The system's not good. It has to change. And this was, in fact, the stimulus that was given to the doctors in Nebraska, not Harvard. And they created the ATLS, the Advanced Trauma Life Support, which the American College of Surgeons took, and it actually spread it throughout the world. Today, so that you know, we have about 2 million doctors and nurses trained in it throughout the world. In Greece, we have actually 11,500 doctors who've gone through this training, and we've had 10 training centres in the 6 university hospitals, in the 2 military hospitals, 401 and 251, in a private hospital, and in Cyprus. We hope that with this new grant, that includes not only ATLS, but also PHTLS and ATCN, we will be able to have the entire range of trauma that will be able to treat all phases of trauma in Greece. And I think that it is important to thank the foundation that is, in fact, supporting all those who are participating in this great endeavour. Thank you very much. Thank you for everything that you have done.
Panayoti. I would like to say I've been at the Stavros Niarchos Foundation for a very short period of time. And in certain presentations and some press releases, we talk a lot about numbers, about figures or technical data. We say we did this grant, it cost this amount, or we built this building, or we gave this equipment. And buildings are really nice, particularly when they're designed by Renzo Piano. And the airplanes are also very nice, but behind all the millions of euros that we hear about, in my mind and in your mind, this is something that we sometimes don't understand. There are human lives behind all these numbers. So only one airborne service, an air ambulance service, transporting one person. So if a helicopter flies once or a plane flies once, it can save a human life. And if an ambulance arrives in time, a human life can be saved. So just imagine how many lives can be saved by 143 ambulances. This is why we say, we mention the numbers, because we want to stress the fact that human lives are saved. And Andreas said this, and sometimes we dwell on one thing and we forget other things. And Panos Vazeos, I had a chat this morning, and we talked about 30,000 patients which need a radiotherapy. 30,000 patients per year that need radiotherapy. So just imagine how many lives we're trying to improve. So we're trying to improve treatment for them, we're trying to improve diagnosis, we're trying to improve the quality of their life. So this is what we need to take home, the benefit. We shouldn't look at the numbers. We should imagine the benefit, the true benefit of what we're doing. That's all I had to say. Thank you very much. Before we take the last questions and then conclude for today, I thanked all the official guests in the beginning, but I'd like to say one more thing regarding the President of the Hellenic Republic, whose term of office has now come to its end almost, Mr. Prokopis Pavlopoulos. I'd like to thank him because he's always stood by us, and he always does a great job. He's always shown interest, he's always tried to help us, and I'd like to thank him as SNF, as a Greek citizen, as Andreas, for the services he has offered to our country, to Greece, in his role as President of the Hellenic Republic. Could you take the floor, President? Andreas, thank you very much for everything that I've experienced with you during my term in office, in a difficult time for Greece. And I understood that in Greece, in order for me to be able to use the title from an old film, there are people. There are people. And there are Greeks. Greeks who may live outside Greece, but they are Greek at heart. They understand the anxiety of the Greeks. They understand what the Greeks are going through. And I'd like to thank you even more, both yourself and the Stavros Niarchos Foundation, for this pillar, the pillar which is called health. Out of the 4 things that you are supporting, and I'm talking about the SNF, one of the pillars is that of health. And the pillar of health has something that is very special. And I don't think this is an exaggeration. I think it's even more important than the SNFCC and the place where we are today. Because what you've done in this period of time, in this difficult period, is that you supported the social welfare state in Greece and the social fabric at a time when they were going through a very difficult time. And we know that any cultural monument in a society that is torn cannot symbolize anything, really. So this pillar, the health pillar, it shows the sensitivity of the Stavros Niarchos Foundation and how important it considers man. Man is at the center of what it does. And this is also a cultural matter. It's a cultural issue. Let's not forget that the European civilization, the Western civilization, started from Greece. And it's all about man. It's anthropocentric. So if man cannot defend his values, if man cannot develop his personality, no work of culture has any meaning for that person. So works of culture exist only for people who have dignity and who are creative. So this is what was offered by the Health Initiative. And I'm not exaggerating. Out of everything that you've done, this is the most important one. And we know that now Greece is out of the woods, but Greece still needs help. So let me say, and I'm not exaggerating, that I'm really happy that I was with you, because I have the experience that in this country, we still have the great benefactors. This lives on. And we know that it may be many years, 200 years away from the Greek Revolution. We've got the modern Greek state, but we know that in this state we had true benefactors that were truly great. And this is a tradition that you continue. And I hope that there will be others to be with you by your side. And I see that there are other benefactors. And we heard about this. So it's not the size that matters. It's the will that matters. It's people's dignity. Thanasis and Marina Martinou, Mrs. Perotti, they're great benefactors, and I've known them, and I really appreciate what they've done. So I hope that others will follow in your footsteps, because the greatest contribution of the SNF is to find other benefactors that will also follow in its footsteps. But what you have achieved so far is truly great. It's a contribution to the country and its experience for the entire nation. So thank you very much, and God bless.
Thank you very much. And before we close, we are opening up for questions. You can put any question you want that's of a general interest. So do you have any question on health? This is a more general Q&A. The lady. Your Beatitude, President of the Republic, Prime Minister, Ministers of Health, incumbent and previous. Ladies and gentlemen, my name is Lydia Ioannidou-Bouzaka. I'm a gynecologist, president of the Greek Society for the breast, and we have in fact been for 40 years in Greece. I'd like to warmly congratulate you for the work. I think that it appeared almost surreal to me, but we see that it's taking place, and I feel very touched by this. I would like to ask, could you help the Ministry of Health? I represent Greece in the EU in the last 5 years with respect to breast cancer and the breast centres. So could you help the ministry to realise in Greece, the only country in the EU that does not have this, to have, in fact, the organised screening of women by providing them with mammograms for breast cancer. If this programme takes place, a lot of the women who die will not die prematurely. I hope that this can actually be done. Thank you. I'd like to answer that generally and specifically. given the size of this endeavour, we have said that we cannot do anything else. But on the other hand, this is something that's very important indeed. And if you can make an application, there are the ways and means, and we will examine it by way of exemption because this appears to be a very important thing. But please do submit an application. Anybody else? Good evening. My name is Hadjimaris Panagiotis, and I'm a simple citizen, and I'd like to express my congratulations for the humanitarian and national work that is taking place by you. But I think that we would like to extend congratulations for the humane approach. And I'd like to actually say that we have public and private sectors collaboration, but we have volunteerism also. I'm a member of the large team of rescuers, which manages crisis, and we wanted to showcase the initiative for health. We went to Agathonisos, Pseramo, Chalki, Kassos, Karpathos, and we're going to go for 3 days in order to train the inhabitants in first aid. We're going to certify 15 people in using a defibrillator, and we're going to offer free of charge a defibrillator on local level. So we are certified in giving CPR, and we're very pleased that you talked about trauma because we've also gone through the trauma management certification. My question is the following. If we actually fulfill your criteria, could we be part of a program which is related to health and which is along the lines that I just described? Thank you very much, because what you said for volunteerism or about volunteerism is very important with respect. The second point, I'd like to actually point you towards Mr. Kourouvalis, who's responsible for the program, and we can look at this. And I would like to say thank you for the volunteerism and the ideas that you have. Congratulations. Panagiotis. Good afternoon. My name is Natasha Drekoshi, and I'm the president of Union for the Treatment of Children's Trauma. Before I start, I'd like to thank you for what you've done. I'd like to thank you personally because the Stavros Niarchos Foundation has been by our side many times in recent years. Now, a question with respect to the ATLS seminars. If these include seminars for children, for children's trauma, do they actually encompass APLS? A very good question. Takis is the person who will respond. Yes, there is a special chapter for pediatric trauma, and people go through the simulation for addressing children's trauma. Is it part of it? Yes. And if you'd like more information, please speak with Mr. Kourouvalis, or if you address your query through the foundation, and we will respond. I see some young children above. I'd like to see a lot of young people, but they always sit far away from the stage. Is there one of the young people present here who'd like to put a question? No? So there are no strange questions. I'd like to make that clear. Thank you. Good evening. I'm the scientific director from EDIPAP Athens, and we'd like to thank you for everything that you've offered to ELIPAP and everything that we're trying to do in ELIPAP. I'd like to say in the new children's hospital in Thessaloniki, is there going to be inpatient beds? Because at this moment we do not have a rehab centre. There's no, in fact, inpatient child beds for rehabilitation. I don't know if we do, and I'm interested in learning also. If you want to answer, I just say that I don't know. Off the mic, there's a comment off the mic. So this appears to be very interesting. We're going to look into it because we don't know where to give you an answer to it now. So that's the truth of the matter. It seems to be a natural thing, and we'll look into it. Please leave us your name because we would like to respond because it seems to be very interesting. Mr. Polakis has put a question. Let's have somebody else speak because we know that it's going to be a difficult question. So let everybody else get their question in first. Good evening. My name is Frango, and I'd like to congratulate you also. The greatest increase in health incidents in recent years has to do with mental health, because I haven't heard the approach on this. I want to know if part of the initiative or a provision for something that is broader and more encompassing in mental health. You're completely right, and it's something that we see worldwide. We see that there is this global focus on mental health. There's not something that we've actually set in motion with respect to mental health, but I would like to talk about certain collaborations. One of our grantee is the Child Mind Institute in New York with Mr. Howard Koplovich, and this does really tremendous work for mental health, especially for the young. So we've already spoken to them, and when the hospitals are operational, we will have programs with local bodies and agencies, but it's something that we have in mind, and it's something that we're going to look into. But this is together with the local agencies. But you're right. And thank you for actually mentioning this. Good evening. Thank you for this great effort that you are making. My name is Boris, and I'm the head of surgery in Attica University, and at the same time I'm also the director who's in charge of the PhD program for health crisis management. And I have two questions. We want to have the emergency services delivered in the field also of the migration service. So it has to do with the immigration. So do you actually know of anything that you're doing in emergency psychosocial supports for immigrants? No, we have a lot of programs that pertain to migrants, but we don't have something that has to do with that. We help in certain programs. We cannot do it all. And a second question, the public and private sector partnership, which is being kicked off in certain hospitals. How can this be put into practice in academia? Do you have any thoughts on this? We don't have thoughts, but we are interested if we have proposals that come to us, ideas in which we can help in order to take things forward. We're talking about public and private sector. So as a foundation, we actually help kick off these ideas and launch them. If you have proposals, we're very interested in hearing them. It's something that we believe in.
The lady over there, my name is Zoe Dramatoglu. I'm from the KEFI, the Cancer Patients Organization. I'm happy to be with you again. 3 years ago, if I'm not mistaken, we had a similar gathering, and there I had asked about the hospices for terminal patients. I'd like to thank the SNF because they have supported all NGOs that try to fill in the gaps that the state doesn't offer services to. After my encouragement, a committee was set up at RAND last year, and it helped because palliative care from the onset of cancer was included. This has stopped because we had elections. Mr. Xanthos didn't vote for this, and 6 months have gone by, and again we have no news on what the government now intends to do about it. But the question is, do you still have this vision to have hospices in Greece? Because right now we only have Spiliopoulio as the only public hospice for terminal patients. This is something we believe in the US where I live, and in the UK the hospice is very widespread, and we're talking about human dignity here. And Panos can tell us a little bit about the efforts that we've made And maybe from the minister, they can also tell us a few things and maybe some ideas. Panos, the only thing I'd like to add is that together we're starting with the legal entity. We're trying to set it up properly. Unfortunately, we have legislation dating back to 1980 regarding hospices. Now, in this committee in which Mrs. Gramatoglou is participating, we're all moving in that direction. That is what we have in mind. And what we want is a strategic plan for the development of palliative care. This will be presented to the Ministry of Health in the end. I just want to add one more thing. I'd like to ask you, because we have people from the ministry today here, you must take care. There must be beds for terminal patients in hospitals, because it's terrible, because a lot of people are taken out of the hospital, they're discharged, and they're sent home to die. So there should be beds for these terminal patients. This is important not just for cancer, but for all diseases. My intervention will be with, I'd like to show respect vis-a-vis the gathering and the event, and this has to do with the patriotism of the benefactors, of the foundations, of all the private individuals. Hello, Mrs. Perotti, nice to see you again. So we see that these benefactors helped Greece and continue to help Greece, not just in the crisis that is. So I don't want to go into the details as to why infections that had been taken out by the previous political leadership and the cyclotrons and so on and so forth. I don't think it's good for us to discuss these matters now. We should show respect. And I just want to say one thing. We are very sensitive when it comes to cancer patients. And we want to offer support to a vulnerable group, a part of society that suffers. And we know that the family of cancer patients also goes through a period of shock. So what we want is for people not to suffer. And we don't want to cause any inconvenience. So at the beginning of March, we will have care at home. There will be a special bill, and are following the opinion by the committee. And in the bill on public health, there will be many other matters settled. So you said that the hospice is absent in Greece. So we're talking about terminal patients or people that have undergone palliative care or support, because we know there are cases that for the average family, the Greek family, can deal with at home. They have the courage, they have the strength, but there are certain things that they can't do alone at home. So in the next few months, and I'm really happy, Mr. Dracopoulos, that you are very sensitive when it comes to this issue. We will come to you if we need to. There will be a hospital in Athens that will be converted in the legal form that it has. It's a legal entity, and it will be converted into a hospice. This is what's missing in Greece. And of course, the Greek church is trying. We know that a lot of priests in Greece are also helping when it comes to palliative care. But this is non-partisan. We need to have hospices in Greece. So we will have a comprehensive plan which will deal with this matter. And let me also talk about the last part of the grant. And I'd like to say that you were kind enough to accept Mrs. Roussos's proposal, and it's very important to understand what emergency care means and how emergency care is linked to a CAV and to the ambulance service and the air ambulance services, and what this means for Evangelismos, which is like the most important hospital. And it's very important for it to have modern emergency care services, because we want to have two entrances, one for the patients and the carers and the paramedics, and one for the patients. We want all this. So on behalf of the state, and I'm not talking about governments here, this is what I had to say, and I'd like to say that I fully respect the people here and the event. So I stop here. Thank you very much. Any other questions? Hello. Since you talked about young people, and since you want to ask young people, I'm addressing you. You asked young people what they think of these events unfolding before us. I would like to make a comment. I am a student at the medical school, and from the moment that I started studying, I feel that this country is paying to make me a doctor, and then something happens along the way, and I am not used in the suitable way by the Greek state when I finish, when I graduate. So I really want to say a big thank you, because now you've given me hope to work better and to stay in Greece. You give me hope so that I can remain in Greece and not leave the country. This was the greatest gift. There is no better gift than what the young medical student just said. Thank you. Thank you very much. Is that it? Have we finished? I think we're done. Thank you very much.
Γιατί? Ναι, όπως είπαμε και πριν...
As we said before, we will now have the counseling next door. Whoever wants us to see what happens, because here we have the collaboration between the ministries and our team. So we're talking about the Special Advisory Committee meeting. So if you want, you can attend. You can watch what we're doing. Thank you. think that we can skip the introductions. We've been here for a long time. We know who is who. So let us get down to the nitty-gritty. And so let us begin from you. My name is Marios Themistokleos. I am from my name is Panagiotis Petropoulos from the ministry. Grigoropoulos Tassos. I am Director of Evangelismos. Frosula Romanidou. I am from the nursing department of the University of Athens. I am from the ACAF. I'm president. Vasilis Tsamis, SNF. Yorgos Agouridis, SNF. Stelios Vasiliakis, SNF. My name is, I am from the Ministry of Health. I am from the Ministry of Health. Mr. Kikilias, Minister of Health. Christos Karaplis, Ministry of Finance. Irini Kapelaki, I am from the Ministry of Education. I'm from Hill International, says the next speaker. Fedon Perakis, Hill International. Hill International is a project manager for the 3 hospitals under the Health Initiative of the SNF. Roussos Haralabos, I'm a doctor. I'm the one who's behind the soul. Vasilis Kaskarelis, SNF. I am a doctor. I am a consultant for the SNF. Christina Labropoulou, Andreas Dracopoulos, SNF, and Yannis Servakis, SNF. So let us begin with Komotini, the first hospital. Let me change the slides. Where are we? We have completed you have completed the studies of the infrastructure projects. They've been approved by the Ministry of Infrastructure. I heard earlier from Mr. Petropoulos that on the 10th of the month there will be a discussion at the committees, just a small, there are 13 in the plenary session. So if all goes well, we can say that this grant will be ready for implementation end of next week. The final study of the project, we received it from Renzo Piano. We will share it with you, of course, in order for it to be approved, in order for us to move on to the next step. Now, I'd like to tell me a little bit about the tendering of the construction part. Before the tendering, we have to finish with the expropriation. There we will use 7A, Article 7A, and the expropriations are expected to be completed end of April, and then we will begin the tendering of the process. Of course, we have the cadastre, so we will go according to the time plan. The expropriations will not affect the timeline. It will be one of the conditions precedent. So what about the procedures that we will follow? Tendering and implementation, or not yet? Well, we don't have anything specific because we're ready for both eventualities, both scenarios, meaning, let me say that we will stick to the timeline even if we actually have the road or a solution where we can get some help in the tendering process. So the deadlines are according to the contract, and let me say that these time limits, these deadlines will be respected, and they're in the law. So let us now move on, if you have no comments, to the University Pediatric Hospital in Thessaloniki. Here the study is going according to plan, the final study, May of 2020. It will be delivered and we'll all look at it again. We're preparing the law. Discussions have started with the 4th IPE, and we are following the same process. Whatever we did for Komotini, we're doing here the same in order for us to mature the organization, the staffing, and everything that is required in order for this new hospital to be constructed. Infrastructure studies, well, they are right now in the process of the environmental permitting process. It's at the decentralized administration. According to the deadline, it will be ready 2-3 months from now. It will be finished. And as you said, once we finish with Komotini next week, end of next week, which is a roadmap for Thessaloniki, we will have the organogram and the rules of procedure for the Pediatric Hospital in Thessaloniki. A short while ago, I spoke to Mr. Karagiannis, who is head of the department in the Aristotle University of Thessaloniki. Since we're talking about a university, it's good to start meeting them. I think if we could do so next month. I've also spoken to the head of the medical school, but we've already had a discussion with the Minister of Health as to what we will do in Thessaloniki. There, the Ministry of Education is also involved. So first, we will discuss matters with the Minister of Health, and then the medical school of the University of Thessaloniki will play a leading role, both in the committees, but also in creating the organogram for the Thessaloniki University Pediatric Clinic. So I'm moving fast. Now Sparta, General Hospital of Sparta, preliminary study is in progress. 18th of February is the day that we will receive it. We estimate that beginning of March we'll be able to move on and move further. We will, in the meantime, give you the clinical program and the building program. In order to agree on it, you are the ones that will approve the clinical and building program. We will submit it to you, just like we did in the case of Thessaloniki and Komotini, in order for us to agree that this is the hospital, and then we will move according to plan. So beginning of March, we will get into contact with you in order to set the meeting. Everything all is well in relation to Sparta. Everything is moving according to plan. Evangelismos Hospital. Here we have the first grant that will be implemented in the month of March. Some beds, that's the only thing that's missing. We're very happy that things have gone so well. End of March, we will be in a position to say that we've come to the end of the one cycle out of the 8 in total, and then we can focus on the rest. Of course, we have to start discussing the emergency care departments, and this is something we need to discuss further. I had meetings with Mr. Martinos and Mrs. Perotti, and we agreed that we will work on our plan and our timeline, and they will follow the payment plan that we have already have. So they, Evangelismos will be talking to us. We will be coordinating the donors. So there are the 2 nursing departments. Yes, I'm a new member. I would like to say that there's already a first draft regarding the architectural designs, and this can be used if you like. What we need is an update, either from the SNF or I don't know else who can take over. So what is needed is an update of the initial plans, which in 2014-15 I was there. This had been done together with Mr. Kyriakidis from the Ethniki grant. So we can give you these plans, and then we can work on these plans and just do an update. I agree, if you agree, because you talked about synergy. So the NBG, the National Bank of Greece, gave a grant to Evangelismos. I'd like to thank Professor Roussos on the record, who contributed so that Niarchos could put its hand a bit more in its pocket and offer more to society. Since we already have a ready study, maybe this study can be used in order for us to save time. This is important for us, and I'd like to repeat once again that during the when we have Evangelismo on call, we have 1,300 people entering. Of course, the emergency care, this is very important, and we know that people work there. People want to have dignity, and they want to receive the services of Evangelismos Hospital, which is a fantastic hospital. We don't want everybody to throw away something that that's finished. We will look at the study, we will update it, and in order for us to move on. So, nursing departments from ECPA and Evangelismos Hospital. This was ratified by law on the 27th of January. So, I've already come into contact with Mrs. Lemonidou and Mrs. Kotanidou. We have discussed, and now with the new governor of Evangelismos, we have to sit and upgrade the timelines. So we're entering the implementation phase. We have to look at procurement, all the procedures, and in order for us to see the implementation of this grant.
So when we're talking about the ratification of the law, this is with the agreement of the government, so they have to vote it. So this was important. It was a wide majority, and I think this is something that we can take as a given fact, but I think it's very important to actually state this, that there was a very wide majority before and today. So let's go to the next matter. The PET scans. So we are now evaluating the various offers. We've met up with the two companies, and we are ready to go to the next phase in order to finalize our choice. So we've spoken with the committee of the Hellenic Republic that advisors. Let us say that the foundation does not choose. It does the financial assessment. The technical assessment is performed by the Greek state, because the Greek state will be the user. So we are now in a phase of completing the assessment. We need to have, or we will have a clear picture mid-February rather, about the spaces and the staffing. So the spaces in which these piece of equipment will be accommodated are part of the obligations of the Hellenic state, and we need to have the timeline, because we don't want to buy something where we don't know, or for which we don't know where it will be placed. So I'd like to have your comments thereon. Let's start in the matter of staffing. Within the week, and in the next week, we will have completed the planning for the staff that is required in each hospital. The Ministry of Health is in fact in contact with the hospitals that have listed their needs. Now, with respect to the infrastructure, we have released the budget from the Ministry of Health in order to have the clinical studies from KTIP, which is the technical service that actually creates these infrastructures in the hospitals. There, we'll be able to give a better assessment about when. Each hospital will differ. I think we'll need about 12 months' time. So I think it will be about 12 months. There might be, in fact, a certain leeway necessary in the tender process. We'll see that in the coming week. Thank you very much. Now, 4412. It's the well-known issue. There has been a legislative initiative from the Ministry of Infrastructure, and ODC came back with certain comments. I think that this is something that's going to be resolved quite soon. It's something that we saw from the beginning of the meetings, and we know that it's something that's been put forth. It's in fact important to see the timeline of the hospitals. It's important to have this provision in order to carry out the project in the 12 months that Mr. Themistoglu said. Thank you very much. So we'll be in contact within the month. Let's go to the air ambulance services, GAV. We've worked long and hard on this with the GAV and with the Hellenic Air Force. We're very close to actually completing the agreements and signing with the two suppliers. I must say that we need to congratulate the Hellenic Air Force, because they've devoted a lot of time on this, and I think they've actually guided us in this point, and we all would like to thank them. At least that's what I think. So we actually agree on the contracts. We have to actually make changes to the contracts in order to reflect the change that we've agreed, because so far it only talks about repair. Within February, we're going to actually close all of these matters. We've agreed as to that, and we're going to continue with placing an order. So that's where we're at this point, and we have 2 educational programs for trauma and infection, and here also the contracts have been ratified, and we see that the timelines by Mr. Zodis and Koulouvaris are going to be, in fact, updated in order to go on with ODB and with regeneration and progress. ODB we're expecting to be established and to take things further. I think that we're doing well. I think that things are going, in fact, swimmingly. If we close these small pending matters in February, we'll be able to focus on the tenders, the constructions, and I'm referring to the hospitals, of course. I made a small mistake. I said hotels, but I meant the hospitals. We need to focus on the hospitals. So as we take things further, things become more complex. We have to put these final points to bed and to actually get down to the nitty-gritty. Now, what about the agreement that we have with NVE? I think this is going to happen on the 13th in the morning. We've talked with IME, and they can, and the head nurse and the president. I don't know if we need to have somebody of you present. You're all up to date and an agreement? Yes, we are. That's fine. Thank you very much. Thank you. Mr. Dracopoulos, the next meeting is the 18th meeting on the 19th of March. We have sufficient time ahead of us, and the one after that, the 19th, is April the 5th. Thank you. Sorry, Thursday, April the 30th.